Extremely inadequate staffing, nurses with almost no training or supervision, patient care relegated to a very low priority. Those were the appalling conditions in place at a drug detox clinic in Sydney, which was the subject of a damning coroner's finding today. 3 patients died after being treated with the controversial anti-heroin drug Naltrexone at the private clinic. Families and drug experts are tonight calling for urgent action to ensure there are no more needless deaths. Adam Harvey has this report.
Growing up in a close family on Sydney's Upper North Shore, James Unicum threw himself into life wholeheartedly. As a member of a legendary basketball team at the St Aloysius private school, he gave it his all.
He was very athletic and very lively, wasn't he?
Yeah, he was definitely into his sports. He used to come watch me play. I was a keen basketball player and played for New South Wales, and he was a big supporter of me, and I guess he kind of taught me a lot of what I knew.
He embraced looking after his youngest brother Andrew, who has Down syndrome, and he was idolised by his little brother Matt.
I always felt quite supported by him, and I never questioned his love for me. He was always very supportive of me in anything I did, and very loving of me as well.
And when it came to taking drugs, he showed the same enthusiasm.
When he was about 15, we noticed he was smoking marijuana. And he was very open with me, so I did talk to him about it. And he said to me, "Mum, a lot of people try it, but when I tried it, I loved it."
So when he used heroin, it was with gusto. His first overdose was when he was 18.
Well, he actually was at a friend's house, and the mother came home and found him and rang me, and I said, "Call an ambulance," and I got there before the ambulance, and I had to perform mouth-to-mouth resuscitation on him. So that was really hard.
By his early 20s, he was a long-term user who couldn't get off. It was time for desperate measures. And when you're desperate, this is one of the places you go. The Psych and Soul Clinic in the inner Sydney suburb of Ultimo. Addicts are treated here with the drug Naltrexone. In some cases, it's implanted under the skin to block the effect of opioids like heroin and reduces withdrawal symptoms. Its program of rapid detoxification was an alternative to long-term methadone programs. The implants are a controversial treatment.
There are very strong theoretical arguments as to Naltrexone possibly working, so we need to test it. But so far, the testing over about 15 or 20 years has been negative.
3 months after a slow-release dose of Naltrexone was inserted into his abdomen, and just after he turned 23, James Unicum died.
I guess the first thing I said to the detective was that I'm not too surprised, because, like my mum, it was just that feeling in your gut the whole time he was addicted to heroin that the day could come.
A Sydney coroner has today been highly critical of Naltrexone implants and the way Psych and Soul was run. Staffing was inadequate, assessment of patients were cursory, and it made the most of its clients' desperation.
It appears that a patient only had to present at the clinic to be enthusiastically recommended for rapid opioid detoxification, no matter what their history or situation, without alternatives being discussed or considered, or any information given out of the risks involved.
The Naltrexone that was implanted into James Unicum's abdomen didn't kill him, but experts say he would have had a better chance if he'd stayed on a reliable, properly tested treatment like methadone. The coroner found that Psych and Soul should have taken a lot more care of 2 other patients who died, Michael Poole and 24-year-old Grace Yates, a young mum who'd been on methadone for 4 years and was desperate to get clean so she could look after her child. She also had heart problems, and that made her unsuitable for the treatment. She was poorly supervised at the clinic, collapsed soon after treatment, and never regained consciousness. Naltrexone implants aren't actually approved in Australia because not enough testing has been done, but an administrative loophole allows their use.
How they are allowed to be used for routine purposes in several states in this country beats me. It goes against all the normal regulations, and I think the only explanation I can understand is that this is allowed in this case because they're only drug addicts.
Psych and Soul is still treating drug users, and a different type of naltrexone implant is being used by Dr George O'Neill's Perth clinic.
The implants themselves are not the cause. This is the detox problem with somebody who's not running a proper medical clinic.
Today, the coroner backed earlier criticism of naltrexone implants by the Australian National Council on Drugs. That's the body that advises the government on drugs policy. It's headed by Gino Vumbaka.
For naltrexone implants, this has gone on far too long, many years, thousands of people with implants. We need to start to have a system in place to actually test the efficacy and the safety of these implants before they're continually used.
Drug and addiction expert Dr Alex Wodak says the coroner's findings are distressing.
We really need a national independent inquiry into the regulatory failure, the serious regulatory failure that's gone on with naltrexone implants for over a decade.
James Unicum's family say there just weren't enough rules governing the treatment or the clinic.
And I think that's the message people need to hear, because you always think, no way, that would never happen in my family, but it can happen to any family.
Adam Harvey reporting.